So a flu shot. So what goes in a flu shot? Well, first of all, the influenza virus itself, there's like 5 or 6 different strains because it's hard to pinpoint which one's going to be which, and that's sometimes why it's not really effective because you could get them wrong.
And it's ineffective, not ineffective. Is it a dead virus into the flu shot?
No, it's not a dead virus. They do the
Inactivated vaccine.
activated. So yeah, technically,
Okay.
yeah. So I guess it is dead. Yeah. So it is a dead virus that they do. And a lot of times, even though the flu shot might work for me, it might not work for you. Just because, let's say, influenza type B affects me, you might have the influenza type A. So there's so much mutation going on with influenza where it's really hard to pinpoint anything that's going on. And especially it varies by location and everything. Like I'm not sure each state, but each climate or each region of the United States gets a different kind of flu vaccine based on whatever research that they do to decide on it.
Okay.
Yeah, I think they take like the amount of or the type of influenza that has been affecting that area for a certain amount of time, and then they kind of base it off that, give them numbers, I guess. Another thing that goes there is formaldehyde. Like Matt said, that's naturally produced as a byproduct in our GI tract, and its role is basically to prevent any contamination or any kind of bacterial growth in the actual vaccine itself, because we know that viruses and bacteria are real small, and it's very easy to contaminate certain things. And this you obviously don't want to contaminate because you want to just give that flu vaccine, not any kind of other bacterial or viral infection. Just kind of makes it sterile, more sterile for the most part. Yeah. Another one is aluminum salts, and what this basically does is that it makes your body react more strongly to the influenza, so it kind of produces a greater immune effect, even though it will be the same amount of virus. So it kind of allows us to get injected with less of the virus, but produces a greater effect.
Aluminum salts, interesting.
Yeah, pretty cool, right?
And then next one is a thimerosal.
Yeah, I don't think they use that anymore, but maybe somewhere in the world they probably still do.
Because they could probably use like an antibiotic form now. It was like an antiseptic method to stop the contamination of the product that they were giving.
Yeah, so basically thimerosal, that basically keeps the vials. So initially, when you get your flu shots, you just have one injection and that's one flu shot. Back in the day, they had a vial and you would draw up the vaccine and then give it, and then put the vial in the fridge, and out of that same vial you would take out some more, give it to the next individual. So that the thimerosal, I don't think it's used anymore. And we don't even have multi-use vials for vaccines anymore.
No.
That was just basically used as that just to keep it more clean, more sterile for the most part. And then the chicken egg protein is also used. That's why people with egg allergies usually should avoid it. But I've read online that it doesn't really produce any kind of a great effect on someone that is allergic to egg. But I guess if you're really, really sensitive and really allergic to egg, that's when you might affect it. But for general public, even though if you might have an egg allergy or sensitivity, it should still be okay for the most part.
Yeah. A lot of people don't know that this protein is literally, the virus is injected into like this protein, and it literally helps the vaccine, aka the virus, grow and replicate. So it grows in its fertilized egg.
Right? Is that pretty cool?
That is pretty cool.
I know that's pretty interesting. They grow a virus in a chicken egg.
And that's why, yeah, just like you said, the egg allergies.
Yeah. Another one is gelatin, and that's basically protects it from change in temperature. So you have Jello. It stays Jello in room temperature and stays Jello in when you put it in the fridge. That kind of gives it more of like a temperature gradient barrier. That's what it really does.
And the last one, they give a little bit of antibiotic, and basically, if a bacteria is exposed to it, they could possibly kill the vaccine that you're giving. So it's an antiseptic, and it helps prevent any bacteria from growing. Usually, they give gentamicin or neomycin. And that kind of summarizes that flu vaccine. And regarding the effectiveness of flu vaccines, I did a study, and I didn't look at the statistic, but only 40 to 60% of people actually get the flu shot because of like the stereotype and the media and everything that they hear about it.
Yeah. Like I said, I'm for it if they could, pinpoint the influenza accurately. I'm completely for it. But as a medical professional, I'm required to get it, so I'm okay with getting it.
Can't you like wear a mask and not have to use it?
Yeah, you can, but you're gonna wear
a mask for like 4 months
out of the year. Yeah, I'm not gonna do that. It's uncomfortable. It's like some rooms you just mouth would sweat all day.
Imagine having like the plastic gown on, gloves, and that mask that
Right.
you're breathing.
Just a perception, like me being a nurse, always wearing a mask. Patients are gonna have of the perspective that I'm sick,
Yeah.
always, or I'm gonna infect them with something.
Why is he taking care of my father if he's sick? You know, that kind of stuff.
Right.
Sit your ass home.
Exactly. Yeah. So get vaccinated. Don't take your medical advice from a porn star. Listen to us instead.
Yeah, listen to us, guys. Couple nurses.